Let's see adaptation model of nursing given by Sister Callista Roy. It is also known as Roy adaptation model. Sister Callista Roy was born in 1939. She served in various positions, like she was the chair of the Department of Nursing in Mount St. Mary's College, Los Angeles. She was adjunct professor and director and nurse consultant in St. Mary's Hospital, Arizona. She did her doctorate in sociology in 1977 from the University of California, and she was a fellow of the American Academy of Nursing, and she is active in a number of nursing organizations including the Sigma Theta and North American Nursing Diagnosis Association. She is the author or co-author of number of works including Introduction to Nursing and Adaptation Model, Essentials of the Roy Adaptation Model, Theory, Construction in Nursing and Adaptation Model, and the Roy Adaptation Model, the definitive statement. When she did her graduate work at the University of California in 1964, the inception of her theory started. It was under the guidance of Dorothy East Johnson. And later on, in 1970, Mount St. Mary's College in Los Angeles adopted the Roy adaptation model as the conceptual framework of the undergraduate nursing curricula. The assumptions of Roy's model are: Roy's model has two assumptions mainly. They are the scientific and philosophic. The scientific assumptions are drawn from the general system theory and their adaptation theory by Helson. The philosophical assumptions are from humanism and veritivity. Veritivity is a term which was coined by Roy only to identify the common purposefulness of human existence. So two assumptions are there, and Roy's model presents the four essential elements, that is the person, health, environment and nursing in her theory. The scientific assumptions, as we have already seen, it is taken from the system theory and the adaptation theory. From the system theory, the assumptions include: the man is considered an entire thing, that is holism. Interdependence is there. There are control processors, information feedback, complexity of living things. These are all taken from the systems theory. Then the assumptions which are taken from the adaptation theory are: behavior is adaptive. Adaptation as a function of stimuli and adaptation level. That means each individual has got different adaptation level, and based on the stimuli which is acting on the person, the adaptation will happen. Individual dynamic adaptation level. Each person has got different levels of adaptation. One person's adaptation will be different from that of the other. Positive and active process of responding. So these are the scientific assumptions. The philosophical assumptions are divided into humanism and veritivity. In humanism, we need to think about the person as creative. There is purposefulness, holism, and interpersonal processes. Veritivity, that is the term coined by Roy, that means the common purpose for human existence. So the purposefulness of human existence we need to consider. The unity of purpose, the activity and creativity of human beings, and value and meaning of life. So these are the assumptions that are scientific and philosophic. The concept in Roy's model. The person himself has got two concepts in Roy's model, which is known as the system and adaptation. So, when you talk of the person according to Roy told person is the recipient of nursing care. It can be a person, a family, a group, a community or society. So when we are talking about a person in Roy's model, it can be a person, a family, a group, a community or a society. Each is considered by nurse as a holistic adaptive system. And this adaptive system has got two main things, that is the concept of system is there and concept of adaptation is there. Let's see the system. The person is considered as a holistic being. Individual aspect of parts act together to form a unified being. Person is in constant interaction with the environment and exchange of information, matter and energy occurs between the person and the environment. It can be community and environment also, or family or environment also. Then input, control, output and feedback are the characteristics of a system and are held by the person. So there will be some input which act as a stimuli. Then there will be some control processes which happens inside the humans, which include the control processes, and another term is there which is known as the effectors. Then after that some output or response will be happening. It can be adaptive or which can be not adaptive. If it is not adaptive, again it will act as a feedback. And this is how the human adaptive system works. The human adaptive system has got input, control, output and feedback, something like a computer. Then second thing, adaptation. In this system, stimuli from the external environment are input. Output is the behavioral response that act as feedback, and coping mechanisms are the control processes. So if you see this image, the stimuli is there from the external environment which are the input. Then output is the behavioral response and it can act as a feedback again. And this coping processes happens which are known as the control processes. Again I am telling, there is a stimuli which is acting as the input. Then there are some coping mechanism or control processes which are happening that leads to behavior or output, and which again act as a feedback for the as a stimuli. Now seeing the stimuli. Stimuli is classified into three. They are the focal stimuli, contextual stimuli and residual stimuli. Focal stimuli means immediately confronting and they require immediate attention. Contextual stimuli have a positive or negative influence on the situation, and residual stimuli whose effect is currently not clear. And each person will respond to stimuli in their own way. The range of response is unique to the individual. Each person's adaptation level is constantly changing. It can be because of various factors like their past experience, their knowledge level, their strength or limitations. So stimuli are three. Then output. The output response can be observed, it can be perceived by the nurse, it can be measured and subjectively reported by the person. These responses act as feedback which can be adaptive or ineffective. So The input stimuli the nurse may not be able to perceive by seeing the patient, but the behavior or the output can be observed and perceived by the nurse. It can be measured and it can be reported by the person. So based on that output only the nurse will be acting upon, or the feedback is done. And this behavior which the patient does, it can be either adaptive or ineffective. And one thing which we learned, or which we see in that picture, was the coping mechanism at the center, or the control processes. So based on this control processes only, the person's adaptive system work. There are two types of coping mechanism for a person. Some coping mechanisms are inherited or genetic. Some coping mechanisms are learned. The coping mechanism like the white blood cells defense against our bacterial invasion, that is already in our genetics, or it is inherited. That is a coping mechanism which we do. And something which is learned is something like use of antiseptics to clean a wound. That is a learned mechanism. So this coping mechanism or these control mechanisms are divided into two. One is the regulator and second one is the cognator. The regulator subsystem is a person's physiological coping mechanism to cope by regulation of our body processes, including the neurochemical and endocrine system. Why? During some of our problems, if there is lower oxygen supply, at that time our heart rate and the respiratory rate will be increased as a regulation. So that is the regulatory subsystem. And the next one is the cognitor subsystem. That is a person's mental coping mechanism to cope via self-concept, interdependence, role function, adaptive modes. Through our neurochemical or endocrine system, as well as through learning, judgment, emotion, that is through our mental coping mechanism, the persons will be coping to the stimuli. The subsystems for adaptive modes, or which are known as effectors, or how the cognitor and regulator mechanisms are manifested, or how the nurse can see this mechanism has happened in the body. The external expressions of the cognitor and this regulator mechanism and what all internal processes has happened is seen by four adaptive modes. First is the physiological or the physical mode. The basic need is composed of the needs associated with oxygenation, nutrition, elimination, activity and rest, and protection. The complex processes are associated with the senses, fluid and electrolyte, neurological function and endocrine function. So just nothing, we can see the physiological mode or the physiological adaptation is done or not through certain things like whether oxygenation is achieved, the nutrition, then you will see the elimination, we will see the activity and rest. Then fifth is protection. Sixth, we will see the senses. Seventh, you will see the fluid and electrolyte. Eighth, you will see the neurological function. And ninth, you will see the endocrine function of the patient. Then the second is self-concept or group identity mode. The goal of coping is to have a sense of unity, meaning the purposefulness in the universe, and a sense of identity deals with the psychological and the spiritual aspect of the person. Attention is given to the physical self and the personal self. The physical self composed of the body sensation, body image. The personal self includes self-consistency and moral, ethical, spiritual self. So about the self is the second adaptive mode. The third adaptive mode is the role function mode, which focuses on the primary, secondary and tertiary roles that a person occupies in society and knowing where they stand as a member of society. The primary role, it can be stated as the person's behavior and is defined by the person's sex, age and developmental state. The secondary role are assumed to carry out the task required by the stage of development and primary role. And tertiary role are temporary, freely chosen and may include activities related to the hobbies. Then the fourth adaptive mode is interdependence mode. Focuses on attaining relational integrity through the giving and receiving of love, respect and value. It is achieved with effective communication and relations. Interdependence mode is achieved through interpersonal relations. So these are the four adaptive modes which are known as effectors. So the effectors, the physiological mode, oxygenation, nutrition, elimination, activity and rest, protection, senses, fluid and electrolyte, neurological function, endocrine. Thus these 9 we need to see. Self-concept, physical self and personal self are the two things. The role function mode we need to see and the interdependence mode. The levels of adaptation. There are mainly 3 levels of adaptation a person can have. One is the integrated, second one is the compensatory and third one is the compromised processes. Integrated process means the various modes and subsystems meet the need of the environment and are usually stable processes. Breathing, spiritual realization, successful relationship. So if everything is stable, that is integrated level of adaptation. Second one is compensatory level of adaptation or compensatory processes. The cognitor and regulator are challenged by the environment's need but are working to meet the needs. For example, grief, starting with a new job, compensatory breathing. Both the person and the environment are trying to adjust. The third one is compromised process or compromised level of adaptation. The modes and subsystems are not adequately meeting the environmental challenge. Hypoxia, unresolved loss, abusive relationship are examples. The common stimuli which is affecting the adaptation. One is the culture of the person. The culture of the person includes the socio-economic status, the ethnicity, the belief system. Then family, the structure of the family, the task in the family. Developmental stage includes the age of the person, sex, their heredity, genetic factors. Then integrity of adaptive modes, that is the physiological mode, the self-concept mode, role function mode, interdependence mode, the 4 modes, how all these 4 are connected with a person, that also will be seen as a stimuli which affect the adaptation. Then the cognitive effectiveness, like each person's perception, the level of knowledge they are having, the level of skill they are having. Then environmental considerations like the change in internal or external environment, the medical management, use of drugs, alcohol, tobacco. So all these will affect the adaptation processes. These are the common stimuli which are affecting the adaptation in all human beings. The Roy's adaptation model, as we have told, the input is there, control process is there, then effectors are there, output is there. The stimuli, it is the input. It can be 3: focal, contextual, residual. So stimuli, it is acting on the human system. Then comes the coping mechanism or the control processes. There are two types of coping mechanism which happens. One is the cognitor, that is our endocrine or neurological or chemical actions, reactions which are happening in our body itself. Then the cognitor, that is our learning, our knowledge, our emotional levels. So these are the two coping mechanisms. Then third one is effectors, that are the different adaptive modes. One is the physiological adaptation mode, where we will be seeing about the oxygenation, nutrition, elimination. Then we will be seeing the senses like that. Then there is the self-concept mode, about the personal self. Then there is the role function mode is there, and the last is interdependence mode, and all these modes are connected to each other. So that is how coping process happens. Then based on this coping mechanism, output happens. The output can be an adaptive response or ineffective response, which we called different adaptation levels. It can be integrated, it can be compensatory, or it can be compromised. So based on this output, again it will act as a feedback or stimuli. And this output, or this is what the nurse can see, observe. The meta-paradigms of the adaptation model. Person. Human system can be individuals or group. So when we are talking about person, it can be person, family, organization, or the whole global community. They are having thinking and feeling capacity by which they adjust effectively to change in the environment and affect the environment. Humans are holistic beings that are in constant interaction with their environment. Humans use a system of adaptation to respond to the stimuli they experience. Environment. They are the conditions, circumstances, and influences that affect the human's development and behavior as an adaptive system. It is a stimuli or input, can be positive or negative, that require a person to adapt. So anything which is acting on the person is the environment. Health. It is not freedom from the inevitability of death. We are not telling there is no death, disease, unhappiness and stress, but the ability to cope with them in a competent way. A state where humans can continuously adapt to stimuli. If they cannot adapt, the integrity of the person can be affected negatively. So that is what health is. Then nursing. The goal of nursing is the promotion of adaptation for individuals and group in each of the four adaptive modes. It can be the physiological mode, it can be the self-concept mode, the role function mode, or interdependence mode. All the four modes, the nurse is helping the person or the community to adapt. It will contribute to the health, quality of life, and dying with dignity. Roy's model and nursing process. Roy's model has got 6 steps when we are seeing the nursing process. So in the first step of assessment of nursing process, the Roy's model has divided it into 2. First one is gathering response behaviors of the 4 adaptive modes. You need to gather response related to the physiological function, their self-concept, role function, and interdependence. All these 4 adaptive modes, nurse has to collect data. Then, first thing is the behavioral assessment. And behavioral assessment, the nurse will be seeing in the 4 adaptive modes how the behaviors have happened for the patient. Identify ineffective responses or responses requiring the nurse's support. So the first thing is behavioral assessment, and there you need to see the all 4 adaptive modes. Second, collect the focal, contextual and residual stimuli that is impacting the client. You know that focal stimuli means that stimuli that needs immediately some attention, or immediately that is confronting the person. Then contextual stimuli are the stimuli of the person's internal and external world that can be identified as having positive and negative influence on the situation. And the residual stimuli are external or internal factors whose current effects are unclear. So the stimuli assessment also will be done by the nurse. Then the nurse will be formulating nursing diagnosis. Fourth step is goal setting. Fifth step is planning implementation. Planning the implementation and implementation to be done. And the sixth step is evaluation. So here in Roy's model, just you need to think that the assessment part is divided into two steps. That is behavioral assessment and assessment of the stimuli. So common problems which you observe in the effectors. Here first you need to see the physiological mode. You need to collect data on the physiological mode. First is regarding the oxygenation. Oxygenation means the pattern of oxygen use which is related to the respiratory and cardiovascular physiology and pathophysiology you need to see. Then nutrition related you need to see the pattern of nutrition used for maintaining the human functioning, promoting the growth and repairing the injured tissue. Then we need to see about the elimination, the pattern of elimination of waste products. Then in activity and rest, pattern of activity and rest you need to see. Then protection include pattern related to the skin integrity and immunity you need to assess. In senses, the input channel of the person through which sensory perceptual information is processed you need to see. Then fluid and electrolyte, the complex process of maintaining the fluid and electrolyte balance for the person you need to see. Neurological function you need to assess the key neural processes and the complex relationship of the neural function related to the regulator and cognator coping mechanism. And last, endocrine function include the pattern of endocrine control and regulation that act in conjunction with the nervous system to maintain the control of the body processes. So based on this you will be seeing hypoxia or shock, ventilatory impairment, inadequate gas exchange, altered tissue perfusion. In nutrition you will notice nutrition less than body requirement or nutrition more than body requirements, anorexia, nausea and vomiting. Then you will be seeing in elimination diarrhea, bowel or bladder incontinence, constipation, urinary retention, flatulence, and these are all the things. In activity and rest you can see immobility, potential for sleep pattern disturbance, fatigue, we can see sleep deprivation. In protection you will be seeing disrupted skin integrity, pressure sores, delayed wound healing, infection, ineffective coping with changes in the immune system. In the senses, impairment of the primary senses, potential for injury, then sensory distortion, acute pain, chronic pain, then perceptual impairment you can see in that. Then fluid and electrolyte related dehydration, edema, shock, hypo or hypercalcemia, hypo or hyperkalemia, natremia, acid-base imbalances you can notice here. In the neurological function you can see the decreased level of consciousness, memory deficits, instability of behavior and mood, potential for brain damage, all those things you can see. In the endocrine function you can see problems like ineffective hormone regulation, which is reflected by fatigue, irritability, heat intolerance, then ineffective reproductive development, then instability of the internal cyclical rhythms and stress you can see. Then if we are moving with the physical self, you will be seeing body image disturbance, sexual dysfunction, rape trauma syndrome, loss. And the personal self, if you are seeing anxiety, powerlessness, guilt, low self-esteem, you can notice. And we can see problems with the role function modus. There is a problem in the role transition, role conflict is there, role failure is there. In the interdependence mode, ineffective pattern of giving and receiving nurturing, separation anxiety, loneliness. So these are the problems you will be finding out during the assessment of the 4 modes based on which the nursing diagnosis and care we will be providing. The strength of this model are: the model suggests the influence of multiple causes in a situation, which is a strength when dealing with multifaceted human beings. So when we are seeing human as a holistic being, we will not just see the physiological things. We will see their self-concept, we will see their role function, interdependence, everything. The sequence of concepts in Roy's model follows logically. In the presentation of each of the key concepts, there is recurring idea of adaptation to maintain integrity. Every concept is operationally defined also, so it is going logically. The concept of Roy's model are stated in relatively simple terms. A major strength of the model is that it gave nurses to use observation and interviewing skills in doing an individualized assessment of each person, because each person's adaptive system is different. The concept of Roy's model are applicable within many practice settings of nursing. Even in the introduction we have told Roy's model was used in the curriculum of a college in Los Angeles. The weakness: application of model require a significant input of time and effort. It is time consuming. The model has many elements, systems, structures and multiple concepts. When saying the strength and weakness of the Roy's adaptation model, we need to talk about the characteristics of theory also. Roy's work and the characteristics of theory, if you see, theories are interrelating concept in this Roy's model. It is logical in nature. It is relatively simple and it can be generalized. Theories are the basis for hypothesis. It can be tested and it can be expanded. Theories help in increasing the general body of knowledge, and theories can be used by practitioners to guide and improve their practice. And last, theories must be consistent with other validated theories, laws and principles. Here now also Roy's theory is getting developed. From the model it is getting developed to a theory. It is mostly called a model than a theory. There is a need for continuous research on hypotheses generated by this model, and this model looks similar to how a computer system works with the input, control process and output. Hope you understood this theory. Thank you so much.